Breast cancer screening. Early detection remains the primary way to prevent the development of life-threatening breast cancer. Breast cancers that are detected when smaller or non-palpable are more treatable and thus are associated with a more favorable prognosis. Important screening methods are: 1. Self-breast examination and clinical breast examination. Breast self-examination (BSE) and clinical breast examination (CBE) are inexpensive and non-invasive procedures for the regular examination of breasts, i.e., monthly BSE and annual CBE. Evidence supporting the effectiveness of these two screening methods is controversial and largely inferred. 2. Breast self-awareness. Breast self-awareness does not involve routine or systematic breast self-examination for the purpose of detecting breast cancer. Rather, it is a woman's attunement to the normal appearance and feel of her breasts, so that she can notify her healthcare provider if she experiences breast changes such as pain, a mass, new onset of nipple discharge, or redness. 3. Imaging studies used in breast cancer screening include the following: mammography, ultrasonography (USG), magnetic resonance imaging (MRI). A. Mammography. Mammography is a special type of low-dose X-ray imaging used to create detailed images of the breast. Mammography is currently the best available population-based method to detect breast cancer at an early stage, when treatment is most effective. Mammography can demonstrate microcalcifications smaller than 100 micrometers. It often reveals lesions before they become palpable by clinical breast examination (CBE), and, on average, 1 to 2 years before being found by breast self-examination (BSE). An estimated 48 million mammograms are performed each year in the United States. The U.S. Preventive Services Task Force (USPSTF) estimates the benefit of mammography in women aged 50 to 74 years to be a 30% reduction in risk of death from breast cancer. For women aged 40 to 49 years, the risk of death is decreased by 17%. There are two types of mammography examinations: screening and diagnostic. Screening mammography is done in asymptomatic women. Diagnostic mammography is performed in symptomatic women, e.g., when a breast lump or nipple discharge is found during self-examination or an abnormality is found during screening mammography. This examination is more involved, time-consuming, and expensive than screening mammography and is used to determine the exact size and location of breast abnormalities and to image the surrounding tissue and lymph nodes. Women with breast implants or a personal history of breast cancer will usually require the additional views used in diagnostic mammography. B. Ultrasonography. Ultrasonography has become a widely available and useful adjunct to mammography in the clinical setting. Ultrasound is generally used to assist the clinical examination of a suspicious lesion detected on mammography or physical examination. As a screening device, ultrasonography is limited by a number of factors, most notably by a failure to detect microcalcifications and by poor specificity, 34%. Ultrasonography also provides valuable information about the nature and extent of solid masses and other breast lesions. Ultrasonography may be useful in detecting occult breast cancer in dense breasts. C. Magnetic resonance imaging. In an effort to overcome the limitations of mammography and ultrasonography, MRI has been explored as a modality for detecting breast cancer in women at high risk and in younger women. Combination of T1, T2, and 3D contrast-enhanced MRI techniques has been found to be highly sensitive, approximating 99% when combined with mammography and clinical breast examination, to malignant changes in the breast. MRI has been demonstrated to be an important adjunct screening tool for women with BRCA1 or BRCA2 mutations, identifying cancers at earlier stages. However, breast MRI has limited use as a general screening tool, with a tenfold higher cost than mammography and poor specificity, 26%. resulting in significantly more false positive reads that generate significant additional diagnostic costs and procedures. Thank you everyone for your patience watching. I hope you have enjoyed the video. Keep in touch and subscribe my channel for more related videos. Have a good and healthy life, stay home, stay safe.